So I work at Newham, and so people who aren't familiar, it's in the East End of London, and it's a very deprived borough. It's also, I mean, more than 70% is from ethnic minority populations, and it's one of the youngest boroughs in the country. So what we then have is a lot of people with chronic disease diagnosed very early on, who then spend a bulk of their life traveling to multidisciplinary hospital appointments. And a lot of people really can't afford to take too much time off work. A lot of them provide carer support. There are young moms with kids. And so we found that our non-attendance rates were very high when we started doing this work in 2010, actually. So we initially got some money from the Health Foundation to look at whether it was possible to just replace some face-to-face appointments with online appointments where we didn't need to physically examine people and just look at feasibility. And the feedback from patients was very, very positive. And we went back to the Health Foundation and got some more money for a 2-year piece of work. And what we realized was we couldn't do video consultations in isolation. What we really needed to do was to co-design the patient pathway to make it more user-friendly. And so we started looking specifically at people who repeatedly failed to keep outpatient appointments and whether they could proactively book their own appointments and make it more proactive and responsive. And a bit like what Andrew was saying, it fundamentally changed the way we provided care because patients said that it became more a conversation of equals and they felt equal partners in their clinical management rather than coming to your clinic and then you running the consultation. And so we, along with Trish Greenhalgh and our academic partners, we managed to get some funding from the NIHR for a 3-year project. And what we then started looking was online consultations in various specialties. And I can notice some questions on Slido about outcome measures. And what we were able to demonstrate was both quantitative and qualitative outcome improvements, purely because of greater engagement from patients and carers. And really, we looked at the dynamics of the clinician-patient interaction. We looked at organizational impact, and we looked at impact of national policy. And then again, very grateful to the Health Foundation for awarding us the Scaling Up grant in 2017. And what we've been doing as part of Scaling Up is rolling out online consultations more widely within Barts Health. So we've got about 57 services at the moment using online consultations, and they vary in terms of multidisciplinary teams and services and needs. And we've also been working with some trusts nationally because we want to look at it in different demographics. Mm-hmm. And, you know, for example, the team at Oxford have got people who travel, they have international travelers coming for very specialist care, whereas at Northumbria, it's more a question of geography and wider distances. There are also different ethnic groups. And actually, sustainable environmental care was not part of what we set out to look at, but Jo will fill you in a little bit because she's been doing loads of work around patient focus groups and questionnaires and looking at the wider societal and environmental impact of trying to do more things non-face-to-face.
That's right. Thank you very much, Shanti. That's a really good summary of where you come to so far. And Jo's going to fill us in about some of those social and environmental elements. So Jo, I know that you've presented before and collected data on the environmental sustainability of your service, particularly related to travel. So I was wondering whether you could just tell us a little bit more about what you've done so far and what you plan to do in the future.
Yes, okay, great. So we've been looking at this for a while. So pre-COVID, we did a very simple survey in the outpatient clinic. So we did it in Shanti's diabetes clinic, and we also did it in the specialist tertiary clinic. And we looked at how far patients were travelling to their outpatient appointments just using a very simple survey. We also asked them things about how much time they had to take off work, how much it cost them, and things like that. And so we found that for the local clinic, they were travelling about 5.5 miles return journey to their clinic appointments, but in the specialist clinic, it was about 26 miles per return journey for each appointment. And so we were very aware with about 1 million follow-up appointments at Barts Health a year, that was a huge mileage, and that with using remote consultations, we had potential. COVID, we've been doing the patient feedback survey after all the video appointments, which I'm quite sure lots of trusts are doing that.
Yeah.
And we've had about 3,000, more than 3,000 responses to that patient feedback survey. And on that survey, we're including postcode and which hospital site the clinic service is based at. And if the patient had come in face-to-face for their appointment, how would they have travelled? What transport would they have used? So from that information, we can calculate carbon footprint savings for our video appointments. And we haven't actually done it yet, but we're actually going to work further with you as a team at the Centre for Sustainable Healthcare to look at what the carbon footprint savings are from those 3,000 responses that we've got. So that's our plan at the moment.